Welcome to the Thyroidless Life podcast with me, Dr. Rebecca Warren. I created this podcast because I wanted to empower, educate, and equip women to not only just truly understand thyroid hormones, but understand their bodies and how to get themselves well. This is such a unique podcast because not only am I a doctor that's worked with women all over the world on reclaiming their health, but I've walked that same path as well. If you want more information about what it looks like to work with me, get my free Optimal Lab ebook, get plugged into my amazing Thyroid Inner Circle community, as well as join my newsletter, go to my website, drrebeccawarren.com. All right, guys. So today let's talk about something that's really important to understand when you've been diagnosed with a thyroid issue, been diagnosed with Hashimoto's or hypothyroidism, and what that might look like over time. I want to talk about this topic because usually when I have someone in my community group or someone throughout the years that comes in to see me, they get really confused. Like, I have these symptoms, heart palpitations, or like your heart skipping a beat. I'm feeling more anxious, more overheated. Like, you're having these symptoms that when you Google them, they feel like they're hyper, but when you had lab work done or any other time, you feel like you're hypo. So hyper is having too much active T3, too much T4. Hypo is not having enough T4, not having enough T3. Well, I want to talk about why this happens when you do have hypothyroidism and what it means. This is an important symptom that should really encourage you to be like, no, I've got to get down to the cause to my thyroid dysregulation. Now, a majority of hypothyroidism is autoimmune related. Okay, so Hashimoto's, and then there's Graves, which is hyper. So I'm just going to talk about hypo that feels like you have too much thyroid hormones, right? So majority of thyroid gland disorders are going to be autoimmune related. And this is a frustrating thing to understand within our medical system because essentially there is no treatment for this autoimmune disorder. There are things that doctors can try, like immune modulator medications that are out there. But even if you try this immune modulating medication, it doesn't correct the autoimmune disorder. If you use it, even if it's low dose, you still need it long term. It's not addressing the overall trigger that's causing this hyperreaction of your immune system to cause an autoimmune disorder. Okay. But essentially, across the board, only like a small percentage of doctors might consider immune modulating drugs. But for a majority of practitioners, endocrinologists, what ends up happening is either you don't get tested for thyroid antibodies. Okay, like there's like, okay, you have hypothyroidism, or they test it and confirm it's there. And again, nothing's really done for it. Or they test it every year. I had someone come in where his levels got up to 6,000. This was years ago, 6,000. And he's like, yeah, I mean, I have years of this number of TPO antibodies was at a 6,000, which is very, very high. So why? Like, why don't doctors really talk about it? Endocrinologists, why do some not even test it? Because in the end, when you're kind of going into that medical system, the idea is this is the common thought process. Is it going to change my treatment plan? No. They're not going to change what they're going to give to you. In the end, if you have an autoimmune disorder that is now affecting your thyroid hormone levels, you're just going to be put on thyroid hormones. And that's it, right? That doesn't correct anything. It's going to make you feel better. So what I tend to see is that people are like, oh my gosh, like I have this thyroid issue. Oh, finally, I have the answers. I went to go see this great endocrinologist, put me on thyroid meds. They'll recommend this endocrinologist when they get sent on their way without realizing that you shouldn't need thyroid meds. And that if you do have thyroid antibodies and they're not addressed, that not only are you on it now, but as that destruction continues throughout the years, not only are you going to need to stay on it, but over time, you're going to need more of it. And then it's just going to be something you can never come off of. The more your thyroid is destroyed. Okay. So that common idea, like I see that all the time. And I always make a comment about like, if I went back to school or if I had decided to just be a medical doctor instead of a DC, you guys would all think I was the best in the whole entire world because I listen. I know how to help people get on optimal thyroid dosing. And I would just check in on you every once in a while. Like when it comes to meds, it shouldn't be that hard to have someone feel good. The fact that so many people still feel crappy on thyroid meds says a lot about our broken medical system. But I say all that because just getting on thyroid hormones does not correct the issue. And you start to feel better. So in your mind, you're thinking, oh my gosh, like the problem's corrected. No, it's not. You're not producing thyroid hormone because of an underlying issue. So instead of saying what's going on in the hypothalamus, pituitary, what's going on at the thyroid gland, liver, gut, what's going on systemically, essentially what's happening is we're just going to ignore what's happening over here and we're just going to get you on thyroid meds and just give you the end product. So you're dependent on the pill for the end product, and that pill does not help your body make thyroid hormones. That's a problem. We are creating pharmaceutical customers for the rest of a person's life. And some of you guys might not really care for that, right? But that's not who I make my episodes for. I make it for those of you guys that are like, wait, no, I only want to use the medical system for when it's necessary. I want to utilize it for what it's made for in those emergency situations. And I want to live in optimal health. I want to go contrary to the stats and the data that we're seeing here in America. And honestly, in a lot of countries, I'm seeing and working with a lot of women all over the world. And I'm noticing that this is happening in a lot of places, right? But you've got to understand that if you don't, especially remember, a majority of hypothyroid cases are autoimmune related. Now, let's talk about what that means, right? So, Hashimoto's is an autoimmune disorder, and it's where essentially the body's immune system attacks the thyroid gland. I want you to understand something. It's not because your body is stupid and it's failing. And it's like, I feel like when people say, like, oh, my body's attacking itself, it's like, well, your body made a mistake. No, no, it's because there's all these triggers that caused your immune system to work in overtime that when that continues chronically, there's a hyperreactive immune system. I give this example of if I took my child and I put him in front of the TV for 7, 8 hours straight. And then I decide at the end of the day, I'm going to turn off the TV. He is going to overreact. Okay. He's going to have meltdown central. But you wouldn't be like, ugh, there's something wrong with your kid. You'd be like, dude, why'd you put your kid in front of that TV? There's all these underlying triggers, whether it's mold, toxicity, or gut infections. There's different things that your body chronically, or reactivation of Epstein-Barr, or sex hormone, gut, like H. pylori. There could be parasites. There's different things, right, that you have to discover. But if your body is dealing with this chronicity of a problem, right, it's chronic. The immune system is working because your body's intelligent and it's smart and it's going to need to do what it needs to do. Eventually, you're going to have this hyperreactive response creating autoimmune targets to your tissue. Okay. So it's not that your body is dumb, but your body tried to work overtime for you for so long. Now, this chronic condition of Hashimoto's is characterized, you can confirm it on blood work through antibodies, and they target thyroid cells, which, when they are left, unaddressed and uncontrolled, can cause destruction of thyroid cells. Okay. And cause fluctuation in thyroid hormones, short term or even long term. And you know what's frustrating? There's a local endocrinologist that I work with, his patients, and work on the functional side of things. And I've heard multiple times already that, like, when he finally does an ultrasound, a lot of the women that have been struggling within the medical system with like thyroid issues, he specifically will describe a thyroid. It looks like a dog chewed up your thyroid. And the women are usually very shocked when they hear that. Like this can happen to both men and women. They're shocked, right? They're like, what? Why does my thyroid gland look like that? Well, because you had an autoimmune disorder and it was not addressed and it destroyed your tissue. And I think, I don't know, man. I just think that's crazy that this isn't talked about enough in endocrinologist office and doctor's offices. Obviously, not every single person does this. Like there probably are doctors out there that do discuss this with you, but a majority of don't. They're like, oh, let's get you on a pill and send you on your way. You have to understand, like, that's what frustrates me is that in order to make an informed decision, informed consent within our medical system, you have to understand things. Most of the time we don't, and we make decisions, right? And we walk out of there without fully understanding what this means for us long term. Unaddressed Hashimoto's can and will over time chronically destroy thyroid tissue, making it, as this endocrinologist says, as if a dog just chewed up and spit out your thyroid. And again, it is shocking to hear that. Now, let's talk about like kind of like the two different. Oh, and let me go ahead and tell you this. Before we kind of go into why you have hyper symptoms, even though you're hypothyroid and how it's connected to this autoimmune disorder, I want to talk about what it means to have a thyroid autoimmune disorder and the rest of your body. So I've talked about my frustration, that without realizing it, you can be you can be treated like your body is a separate system just because of the way our medical system can be set up. Because if you have an endocrine disorder, you see an endocrinologist. If you have a female related disorder, then you see an OBGYN, and you have a GP and you can have a GI. When it comes to the thyroid, like it's all can be interconnected, right? Now, when it comes to the thyroid autoimmunity, like I feel like there's this kind of underlying approach where, it's treated as a thyroid only issue. And it's not. If you have thyroid autoimmunity, you have a systemic issue. Okay. You're three times as likely having a thyroid autoimmune Hashimoto's or Graves, three times as likely to develop another autoimmune disorder. And think about how shocking that can be. In your life, you had this thyroid issue going on. You went to your doctor. They either put you on med or they said, well, wait and see. And then you go on living your life. And all of a sudden, you're anemic or you're having signs of RA. Your joints are hurting. You're having skin issues. And it feels like it's coming out of nowhere when you might not realize that your thyroglobulin antibodies, your TPO antibodies are through the roof. Okay. Let me share some studies with you, right? A large-scale study in autoimmunity reviews found that individuals with Hashimoto's and Graves have a significantly increased risk of developing other autoimmune disorders, including type 1 diabetes that has been rising significantly in adults. Growing up, it used to be type 1 diabetes, you should be childhood diabetes. But now, as adults, you can develop autoimmune disorder with that pancreas, right? Having thyroid antibodies that are unaddressed, running rampant, so a systemic issue can increase your chances of type 1 diabetes, RA, and systemic lupus. Okay. Another research in the Journal of Clinical Endocrinology and Metabolism demonstrated that patients with autoimmune disorder, autoimmune thyroid disorder, frequently presented with conditions like pernicious anemia, celiac disease, and Addison's disease. All right. Adrenal disorder. Again, you could be feeling good on your doctor got you on Synthroid and you feel great on that. But now you're ending up in the GI doctors or going back into the, endo. And why do you have this adrenal disorder? Why is my iron not coming up with like you have no idea why? And it's because it's autoimmune thyroid disorder is a problem, even though you feel good on Synthroid. Another study here in Rheumatology International reported that there is a high prevalence of thyroid autoimmunity in patients with rheumatic diseases, Sjögren's syndrome, as well as RA. Because of that, research published in the Lancet Diabetes and Endocrinology found that patients with autoimmune thyroid disease have a higher incidence of developing systemic autoimmune conditions, including MS, myasthenia gravis, indicating a systemic predisposition to more autoimmunity. That when I really dug into this like years ago, and I said, like I was frustrated with how many people don't understand the significance of Hashimoto's and how that affects your overall health over time. When I looked into this, because I was frustrated that so many people were put on Synthroid and levothyroxine and they think they're fine only to develop more issues over time. When I looked into this, I was just shocked that this isn't, and maybe this could happen. This is a possibility that it is going to happen because it's never addressed. So essentially, thyroid hormones can cover up a very, like, your thyroid hormones going down in the presence of thyroid autoimmunity or up in the presence of thyroid autoimmunity. That's a symptom of a serious underlying systemic issue that has to be addressed. Another thing that I think is really important, like I thought this was interesting when I came across this study a few years ago, was how that thyroid antibodies, again, when you hear thyroid autoimmunity, thyroid antibodies or Hashimoto's or Graves', you think it's related to the thyroid and thyroid alone. Well, a study published in Brain Behavior and Immunity explored the ability of thyroid antibodies, specifically TPO antibodies, which tends to be the most common one to see really high levels, although I've seen much more higher levels of thyroglobulin antibodies, that they have found that they can cross the blood-brain barrier. The research found that TPO antibodies can enter the brain, potentially leading to neuropsychiatric symptoms such as depression, anxiety, and cognitive impairment in patients with autoimmune thyroid disease. So you're on thyroid hormones. You're feeling good, but now I'm depressed and I'm anxious. And now you got to see maybe a psychiatrist, and you got to see your GP, and they're like, okay, your OBGYN, and they're like, okay, let's get you an antidepressants, anti-anxiety, all because you have thyroid antibodies that were not decreased. That to me blows my freaking mind. And I feel like I don't know, to me, I feel like that's medical malpractice. Like that you could leave your doctor's office and have no idea that the medication you're taking does not correct this, and that now you have the possibility of all these disorders and diseases, right? So really important to understand. You've got to start addressing it. I'm going to do a whole episode on where to start. I've touched on this before. I'm going to do it again. I'm going to put a protocol together for those of you guys that want to start on some supplements. If you want to start on some supplements, I'm going to put that together. I'm going to see if we can get that episode live here. But the biggest thing I want you to understand with this episode, it has to be addressed. It cannot be ignored. And I don't care. You could see the best endocrinologist in the world, because that's what, when people are resistant to my message, they'll be like, well, that's not what my endo said, and they're the best. I mean, I hear that over and over again. I mean, who wants to go to the worst? Who's going to be like, my endocrinologist doesn't agree with you, and I think he might be in the bottom of the group. No, like, I mean, I see some really great care provided by, you know, an OBGYN or a nurse practitioner down the street from us. They might not be the best in the world, but all you need is a practitioner that listens to you, that's willing to learn, that's willing to work with you. Like, that's what you want. Like, I don't care if this is the best surgeon in the world. They're great at surgery. It's not about getting you out, but that's also why functional world. That's what I do as a functional practitioner that's different. Okay. So I didn't want to go into a system where I had to prescribe medication and work with insurance. I wanted to work with, people that needed my help one on helping the body heal. You're not going to get that from the medical system. Okay. So let's go into why you might feel hyper when you have hypothyroidism. Okay. So in Hashimoto's, there's thyroid peroxidase antibodies and thyroglobulin antibodies. And then with Graves, you can have TSI. That's another marker that you can check for Graves. But TPO is an enzyme that is super important for making thyroid hormones, T4 to T3, right? Really important. So TPO antibodies, they'll interfere with that enzymatic process, leading to reduced hormone synthesis. Thyroglobulin antibodies is a protein. Well, let me tell you, thyroglobulin antibodies is another marker. Thyroglobulin is a protein that's essential for thyroid hormone production, for the releasing of thyroid hormones, for the storage of thyroid hormones. So if you have thyroglobulin antibodies, it disrupts the thyroid gland's function and messes up your hormone production. Now, one thing that's really important to understand is when you're looking at thyroid autoimmunity is how the immune system comes into play. When we're looking at thyroid, these disorders, like these autoimmune disorders, there's cytotoxic T cells. There's an imbalance within the T cells, right? Those cytotoxic T cells within Hashimoto's, like this thyroid autoimmunity, they can infiltrate the thyroid gland and they will attack the thyroid follicular cells. Okay. This immune mediated destruction will result in inflammation and loss of thyroid tissue. Going back to that visual, that what the endo said, it's like a dog chewed up because you have this consistent destruction of thyroid cells because of those cytotoxic T cells. Now, another interesting is that we know that studies have told us that cytotoxic, these antibodies and these T cells, they can also destroy eye muscle cells and cells in the eyes. So leading to, you guys may have seen these commercials popping up like thyroid eye, right? Or, like thyroid eye issues like that you find in Graves' disease. Like this is a systemic issue. Now there's different phases of where you can be. Like just because you have thyroid antibodies doesn't mean there is thyroid cell destruction. The goal should always be working on bringing down those thyroid antibodies, right? But let me talk about some of the different levels. And so you're hypothyroid, okay? You're hypothyroid, but you start feeling hyper symptoms. Let me give you two scenarios of people that I've worked with, right? I had a woman that came in to see me. She went into the emergency room, had to go in multiple times because she felt like her throat was closing, chest pain, like palpitations, kind of like her heart's jumping. Went into the hospital. They did blood work and she was hypothyroid. Very confusing. Or she was trending like low hypothyroid, like she wasn't outside of medical range. So she didn't really do anything about it. They didn't really make it seem like it was that big of a deal. Heart tests were fine. And then a week or a couple weeks later, same thing. These feelings, these issues went back in, got the thyroid tested. And it didn't show hyper at all. But then when I tested her full thyroid panel, her thyroglobulin antibodies, which at that point should have been under a 1, were like at a 100, like something insane. So what we ended up doing is we did an overhaul work on protecting the thyroid gland, lots of antioxidant rich nutrients at high levels according to her need, working on a lot on the gut and the gut permeability. And she hasn't had those symptoms in years, right? Really big deal. Another scenario, and this was something recently with someone that he woke up at night and it felt like his heart was like skipping. Like he felt like his heart was something was off with it, right? His TSH was through the roof, which means like it's a signal that you're hypothyroid. But again, thyroid antibodies super high. So guess what we have to do? Get that all down. So you can feel like kind of like I tend to hear it's like that heart jumping, skipping a beat, feeling hot, overly anxious. You can feel those types of symptoms. You can lose some weight if it's a chronic thing. So why does that happen if you're hypothyroid? So as those thyroid cells are destroyed by these, immune cells, there is stored thyroid hormones, T3 and T4, in the thyroid. Okay. They're stored in there. And what ends up happening is that when that cell is destroyed, you get this dump of T4, T3. And a dump of T3 in your bloodstream, metabolism goes super high and everything goes really fast. Like it's just really like you increase kind of how things function. Thyroid hormones like T3 is like putting your foot to the gas, right? It gives you energy at all your cells. Like it's so important for your metabolism and all of that. But when you have this dump, it's like you just started your car and you just decided to put your foot on the gas pedal at like just intense, really fast to go to 100 miles per hour. That's what's happening when you have this dump of T3. And then the release of these thyroid hormones can lead to that transient hyperthyroidism. And it tends to be called Hashitoxicosis, right? That Hashitoxic kind of response. It's transient though. So you're like, but I feel hyper, but I feel hypo. And like, and this can happen even vice versa, like with, hyperthyroidism, according to meds that your doctors might give you, according to if these thyroid antibodies have been destroying your thyroid. If it's not addressed and addressed appropriately, you can destroy those thyroid cells to the point where now your thyroid gland is destroyed and you're not making thyroid hormones. So again, those symptoms can be like feeling anxiety, palpitations, and like feeling like you're hot, like you can't deal with the hot. Now, that's not going to be all the time, right? As this continues, and as that thyroid tissue gets destroyed, then we can see just a chronic state of hypothyroidism, right? Again, like the the dog chewed up thyroid. I was so shocked that he like described it like that. Maybe that's why I'm saying it so many times. And the women I worked with were shocked that he said it like that because it is shocking to think if I had known that this could have happened, I wish someone would have told me so I could have done something about it. So I'm telling you guys. All right. So over time, these results can become permanent. And again, you become a long-term patient for thyroid meds, which I think it's not cool. Like I just don't. A lot of you guys are like, well, I feel, I've heard like, oh, well, I feel good and this is fine. It's no big deal. And no, actually, there's a lot of side effects and complications and issues like with osteopenia, osteoporosis, and your overall metabolism being affected, like quality of life. Like if you don't need thyroid meds, try not try not to be on it, right? Like get down to the cause, understand what's going on. But if you're hypothyroid and you're feeling those hyper symptoms, be aware of what are my antibodies? What were they before? What are they now? And the goal is to work on modulating the immune system to help bring down that immune response and to bring those antibodies as low as you can get them so that they're not a burden on you. And I've worked with so many people that were able to get that. They antibodies gone, thyroid hormones amazing. But there's something that I have seen, and I think this aligns with, like studies that they've found with like autoimmune issues, is that what I found, because I have people that have been with me for years and they check in with me as wellness clients. And what I find is that, we can't afford in this toxic world to not prioritize our health. And like I know with inflation and everything that's happening and everything, even in the chaos of everything, we have to find ways that our health is always our first priority because nothing else in the world matters when you lose your health. We're in that hospital bed when you're being diagnosed with something really serious, right? No time, no money matters. And when you're in that situation, all you are wishing for is that you could go back and had done something differently. Your health is that top priority. Okay. And and what I see is that, especially in this toxic, stressful world, you can't, even if life is stressful, you still have to figure out a way to prioritize your sanity, your body. I mean, like, with my coaching clients, like sometimes we're doing like 10, 15 different supplements depending on their protocol. But then there's seasons where they're only doing two, right? Or three. Like, I'm not saying every season you have to be doing hardcore all this stuff and fasting and all this stuff. What I'm saying is that even when life is stressful, especially when life is stressful, that's when you have to stop and figure out how you can still do it. When I have women that are going through a really stressful season, we're not doing crazy protocols. We pivot, we figure out how do we support you through this? Like, how do we support your adrenals and your gut health? Just keep it simple. Don't do anything intensive fasting. Don't do anything intensive, exercise, love and support your body, move, get sunshine. Like they still are able to do things without like the burden of having to do all these things. But especially when you're stressed out, because what I'd found was that those individuals, they can trigger that autoimmune response right back. And it's not just the stress. Like, if you have a family member, you got to take care of, someone passed away, or, things in the home and whatever. It's not usually just the stress. It's the stress compounded by, that's when we tend to not eat well, not prioritize sleep, not get outside. There's things that you can do. And to you, it might feel like, oh, this is like so basic. It's not going outside and getting sunshine in the morning, at lunch, and in the evening. Um, that doesn't seem like a lot. Oh, it's a lot. It's going outside barefoot, breathing, box breathing, working on your vagal nerve stimulation. Just, I've told people like that are just starting off eating, like, hey, don't stress out about organic, non-organic right now. Just do what you can. Focus on protein, focus on veggies, focus on fat. When life gets easier or calmer, then we can go, deeper on the other stuff, but start where you're at, do what you can here, right? And the truth is, there's always going to be something, right? There's always going to be things that pop up. You still have to prioritize your health through that season. Now, as I wrap up here, make sure you go to my website, drrebeccawarren.com, join my newsletter so that you can, if you hear this and you're like, all right, Dr. Rebecca, where do I start with all of this? Like, what supplements could help? I'm going to do a whole deep dive on that. You want to make sure you join my newsletter, get my Optimal Lab ebook, test your antibodies. If you haven't tested them in a really long time, or you've never known what those numbers look like, get my Thyroid Lab ebook, put the link here in the notes section, and make sure you understand that your body was created to heal. Fearfully and wonderful made, right? Innate intelligence wants to work with you. Let's listen to it. Let's remove those stressors so your body can do what it's created to do, which is heal. If you've enjoyed today's episode, please make sure to leave a 5-star review. I love being able to see and read how this information is helping you on your health journey. And make sure to subscribe to the podcast. That way, when new episodes are live, you can have it automatically downloaded to wherever you listen to your podcast. The number one question I get asked is, how do I work with you? If you are interested in finding out more information about me and being a part of my community, go to my website, drrebeccawarren.com. That's dr.rebeccawarren.com. And you should be able to find the answer to your questions there, as well as checking out my Thyroid Inner Circle membership group, getting access to the free Thyroid Labs ebook that I have available for you, and so much more great information.